Hello, my name is Dr. Brian Monahan, the attending physician of the United States Congress. I would like to speak with you today regarding an update on the novel 2019 coronavirus as of the 25th of February 2020. The novel coronavirus is a virus like the Middle East respiratory viral syndrome and the SARS coronavirus. The natural reservoir is believed to be associated with bats. However, the precise animal reservoir for the current coronavirus infection has not yet been identified. The virus began circulating among people in November 2019 in the city of Wuhan, China. As the virus has not been in widespread circulation in humans before, there is little natural resistance to infection. Subsequent person-to-person spread has led to the dissemination throughout China with great social, cultural, and economic impacts in that nation and internationally. The initial attempts to control the spread of virus have focused on tools to limit the travel of people from areas where the virus is present and social distancing to limit the factors leading to person-to-person spread. Although a promising strategy in small outbreaks of infection, like in the SARS infection of 2002, extreme measures of containment have not been fully successful in the current coronavirus outbreak. There is a new name for the disease caused by the novel 2019 coronavirus. The disease that it causes is called COVID, COVID-19. The coronavirus has now spread to more than 33 countries and territories. Many of these cases have no known link to China. There is no reduction in new cases yet, and new countries continue to emerge. We are not seeing community spread in the United States, yet it is possible, if not likely. So far, there are at least 39 cases in the United States. There are no known cases occurring in the region of the District of Columbia, Maryland, or Virginia. The Centers for Disease Control has suggested more cases are likely to be identified in the coming days, including more cases in the United States. It is also likely that person-to-person spread will continue to occur and may occur in the United States. Widespread transmission of COVID-19 in the United States would translate into large numbers of people needing medical care at the same time. Public health and healthcare systems may become overloaded with elevated rates of hospitalizations and deaths. Other critical infrastructure, such as law enforcement, emergency medical services, and transportation industry may also be affected. At this time, there is no vaccine to protect against COVID-19 and no medications approved to treat it. Non-pharmaceutical interventions such as social distancing, ill contact avoidance, surface decontamination, and hand washing would be the most important response strategy today. Infected people can transmit the infection in the absence of appearing to be ill. Methods of airport screening to detect fever are not effective. Overall, this coronavirus is less deadly than SARS, but more contagious. It has a wider spectrum of severity, from asymptomatic to minimally symptomatic to severe illness. Many people are concerned with the chance of death from acquiring the coronavirus infection. In discussing the statistical risk, precise use of language is critical. Generally speaking, you could view this COVID-19 illness as a much worse situation than influenza, but not nearly as bad as SARS. 1 to 2%, however, should be considered a very significant mortality rate and will lead to considerable burden in our healthcare system. Additional information is becoming known from the study of those who become ill from acquiring the disease. This is called the natural history of the infection. The incubation period from the onset of exposure to the virus to the development of symptoms is approximately 4 to 7 days on average. It may exceed 14 days in some patients. Approximately 80% of people infected become ill with a mild infection and then they recover. The vast majority of people recover from this infection. Scientists around the world are studying possible treatments for the virus, and there are developments in exploring these therapy options. In the future, a vaccine will be developed, but this will require time to manufacture, test, and distribute, and then prove its safety and effectiveness. What can you do now in your workplace? First, understand the importance of effective risk communications. One of the most important and effective interventions in a public health response to any event is to effectively communicate what is known, what is unknown, and what is being done to get more information, with the objectives of saving lives and minimizing adverse consequences. You can promote avoidance of infection, such as avoiding close contact with people suffering from acute respiratory infections. Ill individuals should stay out of the workplace until they are recovered. Frequent hand washing, especially after direct contact with ill people or their environment. People with symptoms of acute respiratory infection should practice cough etiquette, such as maintaining distance 3 to 6 feet, covering coughs and sneezes with disposable tissues or clothing, such as coughing into an elbow rather than onto a hand, and frequent hand washing.